What if your dentist could predict your heart attack before your cardiologist could? That sounds shocking, but new research from the American Heart Association, published in December 2025, says your mouth may be sending warning signals directly to your heart, and most people over 65 are completely ignoring them. I'm going to show you 5 warning signs in your teeth and gums that could mean your heart is in danger. Stay until sign number 3. Most doctors never even mention it. Before we begin, this video is for educational purposes only. Always talk to your doctor or dentist about your personal health situation. Now, here's something most people don't know. Your mouth and your heart are connected through your bloodstream. When bacteria from infected gums enter your blood, they travel to your heart and arteries, causing inflammation, plaque buildup, and in some cases, heart attacks and strokes. The American Heart Association now officially links gum disease, called periodontal disease, to heart attacks, stroke, atrial fibrillation, and heart failure. This is 2025 science, and if you're over 65, you need to pay attention. Warning sign number 1. Your gums bleed when you brush or floss. Most people think bleeding gums are normal or a sign they're brushing too hard. They're not. Bleeding gums are one of the earliest signs of gum infection. And once bacteria from that infection enter your bloodstream, they trigger your immune system to produce something called C-reactive protein, or CRP.
Doctors use CRP levels to measure your risk of a heart attack. Study after study shows that patients with gum disease have consistently elevated CRP levels. That constant low-grade infection is like a slow leak in your pipes, gradually damaging your blood vessels from the inside. If your gums bleed regularly, don't ignore it. Tell your dentist. It could be your body's early warning system. Warning sign number 2. Loose or shifting teeth. Your teeth feel loose or have shifted position. As gum disease progresses into what dentists call periodontitis, an advanced stage, it destroys the bone that holds your teeth in place. Teeth may feel wobbly, or you may notice gaps appearing where there were none before. Here's the heart connection. Advanced periodontitis produces higher levels of bacteria in the bloodstream. A 2025 scientific statement from the American Heart Association found that people with worse gum disease had a significantly higher risk of atherosclerosis, that's plaque buildup in the arteries, as well as peripheral artery disease. If your teeth are shifting or feeling loose after age 60, please see a periodontist. This is not just a dental problem anymore. Warning sign number 3, persistent bad breath. You have bad breath that won't go away, even after brushing. Chronic bad breath, also known as halitosis, is often caused by bacteria thriving deep in infected gum pockets. These are the same bacteria that, when they enter the bloodstream, cause arterial inflammation. Research from Harvard Health shows that people with gum disease have 2 to 3 times the risk of a serious cardiovascular event compared to people with healthy gums. 2 to 3 times. And persistent bad breath can be a sign that infection is already well underway. A regular cleaning won't fix deep gum infection. Ask your dentist about a deep cleaning procedure called scaling and root planing, and tell them about any heart conditions you have so they can coordinate your care. Warning sign number 4, receding gums. Your gums are pulling away from your teeth, making them look longer. Receding gums expose the roots of your teeth, which are much more vulnerable to decay and sensitivity. But more importantly, gum recession is a sign of ongoing periodontal disease that has been progressing, often silently, for years. A University of Utah health study found there is a 30% higher chance of a heart attack in someone who has periodontal disease, and up to 2.5 times greater risk of stroke. If your teeth look longer than they used to, that's gum recession. It doesn't reverse on its own. If you notice this, schedule a dental appointment this week. Not next month, this week. Warning sign number 5, missing teeth. You've already lost several teeth, especially before age 70. According to the CDC, 25% of Americans over 65 have lost all their teeth. And here's what the research tells us. Tooth loss is not just the end result of dental neglect. It's a marker of cumulative systemic inflammation that has been running through your body for years. Multiple studies link missing teeth to increased risk of cardiovascular disease, independent of other factors like smoking or diabetes. Every tooth lost to gum disease represents years of bacterial infection that your heart had to deal with. If you've experienced significant tooth loss, talk to your doctor about getting a full cardiovascular risk assessment. Your heart may have been quietly paying the price.
So, what can you actually do about this? Number 1, see your dentist every 3 to 4 months if you have gum disease, not just twice a year. Ask specifically about your periodontal health, not just cavities. Number 2, brush twice a day and floss daily. A January 2025 American Heart Association study found that regular flossing was linked to a lower risk of stroke from blood clots and irregular heartbeats. Number 3, tell your doctor about your gum health and tell your dentist about your heart conditions. These two specialists need to be on the same team for you. Number 4, if you're on Medicare, ask about Medicare Advantage plans that include dental coverage. Over 55% of seniors have no dental benefits at all. That's a serious gap that can have real consequences for your heart.
Your mouth is not separate from your body. What happens in your gums directly affects what happens in your arteries, your heart, and your brain. And the good news is, gum disease is preventable and treatable at any age. If you found this video helpful, please share it with someone you love who is over 65. It might be the most important thing they watch this year. And if you want to learn more about protecting your brain and heart health after 65, subscribe to this channel. New videos every week.